5 kinds of employers you shouldn't work for, even in the 2026 economy. Hi everyone. Welcome back to Nurse Brain RX, the channel where we help nurses and nursing students protect their careers, their mental health, and their financial future. Today we're talking about something that can make or break your career: choosing the right employer. In a difficult economy, many nurses feel pressure to accept any job available. And while financial stability is important, working for the wrong employer can cost you far more in the long run, including your health, license, income potential, and career satisfaction. So today we're discussing 5 types of employers you should avoid, even in the 2026 economy. Let's get started. Number 1. Employers with chronically unsafe staffing. Every nurse understands that healthcare can be unpredictable, but there is a big difference between occasional short staffing and a system that is always unsafe. If an employer consistently assigns unsafe patient loads, ignores staffing complaints, or pressures nurses to take more patients than is reasonable, that is a serious red flag. Unsafe staffing doesn't just increase stress, it increases the risk of medical errors, burnout, and threats to your nursing license. A responsible employer invests in adequate staffing and supports nurses when patient acuity increases. If management repeatedly tells you to just handle it or everyone else does it, that organization may be prioritizing profit over patient safety. And that is not a place where you want to build a long-term career. Number 2. Employers who normalize bullying or toxic culture. Many nurses have heard the phrase "nurses eat their young." Unfortunately, toxic workplace culture still exists in some healthcare environments. Warning signs include constant gossip and cliques, senior staff humiliating new nurses, managers ignoring complaints of bullying, or staff afraid to speak up about safety concerns. A toxic culture doesn't just affect your mood, it can damage your confidence and professional development. Healthy organizations encourage mentorship, collaboration, and psychological safety. If leadership tolerates hostility or intimidation, it usually means the culture starts at the top, and that rarely improves without major organizational change. Number 3. Employers who offer vague or misleading compensation. Your work as a nurse has real value. Employers who are vague about pay, overtime policies, shift differentials, or benefits may be hiding unfavorable conditions. Pay attention to phrases like competitive salary without actual numbers, opportunities for overtime that actually mean chronic short staffing, or benefit packages that look good on paper but provide limited coverage. A transparent employer will clearly explain base pay, overtime rules, vacation and sick leave, retirement contributions, and health benefits. If an employer hesitates to discuss compensation openly, that is a warning sign. Your career is not just about passion, it's also about financial stability. Number 4. Employers with extremely high turnover. High turnover often signals deeper organizational problems. When nurses are leaving constantly, there is usually a reason. Common causes include poor management, unsafe workloads, lack of career development, or burnout from chronic understaffing. Before accepting a job, try to learn how long nurses typically stay in that unit. Ask during interviews, how long have most nurses on this unit been here? If the answer is less than a year for many staff, proceed with caution. Healthy workplaces tend to have a mix of new nurses and experienced staff who have stayed for years. That balance often reflects stronger leadership and a more supportive environment. Number 5. Employers who do not invest in professional growth. Nursing is a lifelong learning profession. Good employers invest in their nurses through continuing education, specialty certifications, mentorship programs, leadership training, and tuition assistance. If an organization treats nurses as easily replaceable labor instead of skilled professionals, that limits your long-term career growth. Your first job may not be perfect, but it should provide opportunities to develop your skills and expand your career options. A supportive employer helps you grow into a stronger clinician and future leader. So let's summarize the 5 employers you should avoid. 1. Employers with chronically unsafe staffing. 2. Employers with toxic workplace culture. 3. Employers who are vague about compensation. 4. Employers with extremely high turnover. 5. Employers who don't invest in nurse development. Remember, the job you accept today can influence your career trajectory for years. Even in a challenging economy, choosing an employer carefully can protect your health, your professional reputation, and your financial future. Thank you for watching Nurse Brain RX. If you found this video helpful, make sure to like, subscribe, and share it with another nurse or nursing student who is preparing to enter the workforce. And in the comments, tell me, what red flags have you seen when interviewing for nursing jobs? Your experience might help another nurse avoid a difficult situation. See you in the next video.